Hello everybody, welcome back to my channel again. Back to back, we have many video talking about meta-analysis and how meta-analysis is not a best treatment option for your client. And then that tied to some sort of a research with evidence-based practice. And today I want to tell you guys, or kind of explain to you why a lot of time a clinician may trying to use one approach which they feel more beneficial to treat their client, and why it is important to get rid of that mindset so you can understanding that sometimes the one size probably will not fitting into the whole basket. And then that's why evidence-based practice are important for the treatment practice. So improving outcome is one of important aspect of the treatment in mental health. And to be able to understand this concept, we utilize multiple research on the client, but we also go through so many different things. Sometimes in the early age of the century, people also use like a deep brain stimulation. They are talking about neurological perspective on a psychological treatment. They are not quite sure if certain treatment will be effective to support a client, especially if client may have bipolar or suffer from deep depression. They are very skeptical about if those one-side approach will support a client. And that's how evidence-based practice came to the intervention, and then use a lot on the people who have major depressive disorder. And it turned out that alternative approach is working, because a lot of treatment selection is aiming on identify on each person's treatment on which is best for them. Hope that makes sense to you guys. So the treatment selection is important in tied to the evidence-based practice, and that's why that different approach of treatment are quite important. And that link to the different type of response to the treatment, the carelessity of the treatment, and also how the therapist or any clinician trying to apply the complex solution and choice to support the client. And people can also figure out which treatment have prioritized the most effective outcome for the client, and at the same time they can also go for different type of detecting a different type of solution they feel is best. Regardless what type of solution you're using, the important thing is you have to understand that different type of treatment is important to utilize. You have to try different type of treatment in order to support your client on the road of recovery. So what treatment selection are we talking about? You may ask me this question. So the treatment selection has to come with a specific problem that the client struggle. Let me emphasize, are a specific problem that the client are struggled doing day-to-day life. They can come up with their personality and then the social demographic. Sorry, every time when I talk about this personality and social demographic, I feel like there's a little stress because it just happened to me when I talk about those things. But then you have to figure out the cultural consideration. So for example, let's say a client has like anxiety symptoms, let's just put it this way. And you have to identify what kind of anxiety they have. It's anxiety due to academic, anxiety due to the work, or anxiety due to like a social gathering or family gathering, or even manage their family member, right? Which one is the important part, and what is your targeting goal for it? Does that have to link with low social skill, or what is their historical social interaction with other people, right? So you kind of go through that. Does the person have some abuse issue when they were a child? Do they develop some sort of being abused by their parent when they were younger? Or is there any like panic attack when they were younger that was unable to resolve? So you had to kind of go through each step in order to figure out which relevant treatment will be good for them, and that's what I mean by selection of the treatment. And that's part of evidence-based practice as well, because you go through the specific client's presentation, you can find out, hey, if this client suffer from like difficulty manage their, let's say, interaction with individual or with a group, or they have issue with interacting with like just public speaking, at work, they cannot do those things. And what is the trigger? What is the problem? So you kind of go through that individual step in order to figure out the best treatment selection for your client. And then by talking about this, I also have to mention a little bit about statistics. I know that a lot of social worker or clinicians may not want to talk about the statistical thing because involved with mathematical thing, they don't want to talk about math. But then statistical are important to put into a perspective and the discussion, because then you can use those statistical information to validating your outcome of the treatment. You can also use those statistical things to figure out which treatment outcome are likely to be success and which treatment outcome are not likely to be success. Either way, you have to figure out a way to manage how you approach will support your client, right? So if you have any question, I really hope you can leave any comment on my YouTube so I can really kind of answer and address those concerns and solution and provide some kind of solution for you if you want to have some answer. Evidence-based practice also involved with judgment, treatment, outcome selection, decision, and then we have to understand some of the treatment are empirical research and are actually measurable, and that's how you use your inquiry into your diagnosis, and you can find a lot of success. And then source of the data, how would you find the source of data? I think that's one of the important things as well. And make sure you pay attention to this section, because your source of data can put into a different outcome, and it can link to different outcome if the source of the data are incorrect or are not be judged or be examined by the empirical practice and approach, then your source of data can be an error. And if you have this sort of data in error, you cannot do a randomized trial, and you will get a lot of weird treatment result in terms of your mental health treatment. So pay attention to the source of data you're having, and you can find some more accurate result in terms of how to support your client. And last thing I want to talk about is the future direction. How would you continue to utilize evidence-based treatment practice on your mental health clinician care to your client? I believe a lot of clinicians struggle with identify the right treatment, and sometimes you may not have enough confidence with your treatment outcome, because this is honestly a very difficult, challenging profession. And then with different type of personality, with different people, you will struggle with finding the best outcome for you, the treatment for your client. But practice can make perfect, so you just have to continue to do a lot of random testing, do a lot of random research, and get a best source of data in order to find your best independent variable to work on and then manage your client. Prior to talking about future direction, I also mentioned about the confident, how you selecting those data. If you have very more confident with your data, and then your treatment outcome tend to be more success. But then you also have to look at a lot of valuable model, and some valuable resource of information are important. The recommendation from your colleague or from your from PhD clinician or from your superior are also important to make sure you consult with the people who have more experience than you to figure out the direction of your treatment. And then take into the assessment into consideration. If your assessment conclude or have include some data, then you can kind of look at those data to figure out if you can generate the knowledge that are relevant to the outcome of the direction for different types of treatment, such as depression or bipolar disorder. So all those things are very important, and I hope today's video give you some insight of how you can, provide more empirical evidence or evidence-based practice on your treatment to your client. If you have any question, feel free to leave any comment on my YouTube channel, and I will see you again at the next video.